Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Thursday, August 13, 2026, episode 102. Today, private and development money is buying the public interest AI infrastructure that government budgets are cutting. The Gates Foundation putting $540 million into the University of Washington's Health Metrics Institute, GiveDirectly getting cash to Venezuelan earthquake survivors 3 weeks after the shock, and the World Bank financing AI compute inside East Africa's climate center. We start in the United States, where the Gates Foundation just committed $540.2 million over 10 years to the Institute for Health Metrics and Evaluation at the University of Washington. It is the largest charitable gift in the university's history.
What makes this significant is the timing. The Institute's own tracking finds development assistance for health fell 21% between 2024 and 2025, driven by a 67% decline in U.S. government spending. This money lands as the public funding base under global health evidence contracts.
GeekWire and Fortune both covered the grant this week. It expands the global burden of disease study from 925 locations to nearly 5,000, extends the Institute's health forecasting work through the year 2100, and funds AI-enabled tools for more local, more timely health evidence.
The five-fold jump in geographic resolution is the operational detail. The Global Burden of Disease Study is the reference dataset that ministries of health, the World Health Organization, and humanitarian planners used to decide where money and medicine go across 204 countries. Subnational estimates change which district gets the clinic.
The Gates Foundation helped found the institute in 2007, and this commitment lands as it approaches its 20th anniversary. Fortune framed the gift as philanthropy stepping in while federal science funding pulls back.
The first expanded estimates are the thing to watch. They arrive inside a funded 10-year window while the traditional public funding base is still shrinking, and they are the test of whether private money holds that data infrastructure together.
Moving to Venezuela, Fast Company reported on August 7 how GiveDirectly compressed its response to the June earthquakes. Minutes after the quake struck, an internal AI tool generated a damage snapshot.
What makes this significant is the order of operations. Satellite imagery models pinpointed the hardest-hit neighborhoods. The team layered poverty data on top to find the families most in need. And then humans checked the map. A ground team confirmed damage locations, and humanitarian OpenStreetMap volunteers verified the tent communities the model had flagged.
3 weeks after the earthquakes, cash was landing on survivors' phones. The same report documents the pattern across the sector. Mercy Corps uses an agentic AI tool built with Cloudera to have disaster report preparation time, and the International Rescue Committee runs satellite-based vaccination targeting, an offline-capable mpox detection app, and education tools reaching refugee learners in more than 40 countries.
Mercy Corps Nayib Orozco put it plainly. It doesn't replace our analysts, it takes care of that mechanical work. 3 weeks from shock to cash is now a number other cash transfer operations can be measured against, and the verification steps GiveDirectly kept. The ground team and the volunteer mappers are the part of this deployment every replication will argue about.
Story 3, the Philippines. The Department of Agriculture is moving drones and AI from pilot to policy for crop protection, combining real-time drone data with historical weather patterns and machine learning models to predict pest infestations and disease outbreaks before the damage is visible.
That is the same architecture as flood or famine early warning. Sensors feeding a predictive model that buys response time, pointed at the assets smallholder livelihoods actually depend on.
The live testbed is bananas, one of the country's top export sectors, under sustained pressure from fusarium wilt. Under an agreement with the department's Davao Regional Field Office, contractor eSupportLink is testing an AI-powered aerial imaging system on 3 banana farms in Davao del Norte and Davao de Oro, using multispectral drone imagery to identify infected plants before symptoms show, count plants, and estimate harvests. The Philippine Daily Inquirer reported the policy push today.
This is where the field reality matters. 3 farms is the entire evidence base right now. Whether presymptomatic detection holds up outside controlled trials is what the Davao results will show, and the department's own framing says a national scale-up decision rides on them.
Moving to Nairobi, the Climate Prediction and Applications Center that serves as the early warning hub for the East African bloc has opened competitive bidding for 2 high-performance computing servers, one conventional and one built for AI workloads. Tuco reported the tender today.
What makes this significant is that the money is going into compute rather than models. The hardware has a named job: scaling the center's digital agroclimate advisory services, the operational layer that converts climate data into planting and food security guidance for the region's farmers.
It is financed by the World Bank's Food Systems Resilience Program for Eastern and Southern Africa. Sealed bids are due at the center's Nairobi offices by 12 noon East Africa time on September 24, with delivery within 2 months of contract signing.
So a regional African climate institution is buying dedicated on-premise AI hardware with development money rather than renting inference from a foreign cloud. The region it serves is under an active drought alert right now, and September 24 is the date that capacity starts being built.
One research note before the watch lists. A study published today in Frontiers in Public Health surveyed 6 of Trinidad and Tobago's 9 county medical officers of health, the country's senior public health leaders, on AI-enabled early warning for a small island developing state.
The barriers they ranked are the finding: budget constraints, 5 of 6; limited technical capacity, 3 of 6; data access, 3 of 6. The authors conclude these systems succeed or fail on infrastructure, workforce, and governance, not on model quality, and warn against treating them as standalone technological solutions.
All 6 named infectious diseases and flooding as the priority use cases, 3 added heat-related risk, 5 of 6 rated dashboards and emergency service integration the most valuable features, and all 6 emphasized equitable access for underserved populations.
For funders and public sector practitioners, this is rare primary evidence from the people who would actually run these systems, gathered before procurement rather than after failure. The demand signal is documented now: dashboards wired into emergency services, budgeted staff, data agreements. The next wave of Caribbean early warning proposals can be read against it.
On the disaster watch, 3 active alerts. A magnitude 7.4 earthquake near San Jose del Palmar in Colombia on August 10 at 110 kilometers depth, with an estimated 5.2 million people in strong shaking, held at red alert with rescue operations ongoing and relief web tracking it as an active emergency. Flooding in China since July 31, with 237,338 people displaced and no deaths reported to date. And an ongoing drought across DR Congo, Kenya, Tanzania, and Uganda, at orange notification since July 29.
That drought is the direct link to the Nairobi story. The center buying the AI server is the early warning hub for exactly those countries, and the advisory service that hardware is meant to scale is the one delivering planting guidance to farmers already inside the alert. The compute arrives after the drought, not before it.
For funding, one live deadline. The Nairobi server tender is open now under the World Bank's National Competitive Bidding Rules, with sealed bids due at 12 noon East Africa time on September 24.
The word doing the work there is sealed. These are physical bids delivered to an office in Nairobi, not an online submission, and delivery is contracted within 2 months of signing. The precedent is the part worth noting: development finance paying for public climate compute on a dated schedule.
The through line today is money. A philanthropic decade for the world's health data backbone, development finance buying climate compute in Nairobi, and cash reaching earthquake survivors because a model drew the damage map fast enough to matter.
And the officials who would run these systems have already said what they need. In Trinidad and Tobago, it was budget, 5 of 6, then technical capacity and data access, 3 of 6 each. That is the governance line. This week's money is going into infrastructure, and infrastructure is what those officials asked for.
That's Impact Signals for Thursday, August 13, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.